Hey guys, it's Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer weight management, hormone pellet therapy, total wellness solutions, intimacy services, and laser hair removal to both men and women. And we also offer gynecology to women and adolescents of all ages. Our goal is to help you live well, age well, and experience everlasting intimacy. And today we're going to talk a little bit about dryness and pain with intercourse. So as we continue to age and mature, we start to notice that the vaginal tissue does change. And what I recommend for my ladies is to start treating the tissue before it's a problem. So usually if you're in your 40s and you're starting to notice any tinge of dryness during intercourse, I want you to start treating the tissue. There's an over-the-counter medication that you can use with hyaluronic acid that you can use twice a week to help strengthen the tissue. And what that hyaluronic acid does is it increases sensitivity, it increases lubrication, it helps to strengthen the tissue and keep it healthy and strong for better enjoyment during intercourse, for less dryness, and also to help with urinary symptoms. Sometimes you're on hormonal birth control and you're not quite even 40 yet and you start to notice dryness. That is a very good product, the over the counter hyaluronic acid that you can put in vaginally at night twice a week. However, if you're getting to be over 40, you may be on birth control, you may not. You're starting to notice that during intercourse, you need to stop and get a lubricant, or you're having some discomfort, or you're noticing more dryness. Then it's time to start treating the tissues consistently. And I like to do that again with the hyaluronic acid that you can get offline or with the prescription of vaginal estrogen. Whenever I'm talking about estrogen vaginally, that's considered topical estrogen. So it's not raising your systemic levels of estrogen, it's simply working on the vaginal tissue. So the hyaluronic acid, the vaginal estrogen. So even if you're not supposed to take estrogen, it is safe for you to use a estrogen product vaginally because it's not going to increase your systemic estrogen levels, but it is going to help with lubrication, sensitivity. It's going to help with tightness. It's going to help with leakage of urine, with coughing, sneezing, jumping, laughing. It's going to help with frequency and urgency, and again, sensitivity and satisfaction, and decrease vaginal dryness. That's one thing, and doing that twice a week at night, right before bedtime. If you're postmenopausal and you're already having a dryness, it's significant. You know you're not producing estrogen. You should definitely be treating the tissue twice a week at night, right before bedtime. So if you have intercourse, put it in after you clean up and use the bathroom after intercourse, because you should be using the bathroom after intercourse each time. And the importance of this vaginal estrogen too is it decreases your risk of urinary tract infections, which is a really big deal because as we age and get in our 70s and 80s and late 60s, those urinary tract infections can make you sick. So because the tissue has thinned and you're not treating it, you're going to increase the risk of getting a urinary tract infection. So to prevent that, treat the vaginal tissue with either the hyaluronic acid, the vaginal estrogen, or both. But treating the tissue twice a week at night is going to help significantly. If you're already having severe symptoms, we usually treat you over a course of about 2 to 3 weeks every night. And then once the tissue gets to where we need it to be, then you can start the twice a week at night. We do have a wonderful device that we can use too, and that we can recommend for our patients. This is called a V-Fit. It actually has a red light, and this goes inside the canal, and it works for about 10 to 12 minutes. It's going to heat the tissue. It's got red lights to increase the blood flow. It's going to help with lubrication, sensitivity, tightening, and leakage of urine with coughing, sneezing, jumping, laughing. It's going to decrease any vaginal dryness, and it's going to improve the enjoyment of intercourse. So this is a device that you can buy. You can use it at home every other day. A lot of our patients will use this, especially when they're young. You just had a baby, you're noticing a little bit of leakage of urine, a little bit of dryness, and things have changed. This is a good option, not only treating the tissue topically, like I talked about before, but also using that V-Fit device every other night until your tissue is where you need it. And then you can use it 2 or 3 times a week as needed to maintain healthy, lubricated, sensitive tissue and decrease urinary symptoms. So as we age and mature, we have to remember to treat the vaginal tissue. You do the vaginal tissue just like you treat your face. You want to prevent problems before they start. That's why we start putting the hyaluronic acid on earlier, before we start getting wrinkles. Same thing with the vaginal tissue. Before you start noticing significant dryness or changes, start treating the tissue for prevention. And if you're already having issues, especially if you're getting repeat urinary tract infections, we should be treating the tissue with either the hyaluronic acid or the vaginal estrogen. Again, vaginal estrogen does not raise your systemic levels. It's just going to treat the tissue topically to keep it healthy, strong, lubricated, sensitive, and orgasmic. So again, I am Dr. Mia at Bella Wellness Center. I am your favorite OBGYN. And my goal is to help you live well, age well, and experience everlasting intimacy. My goal is to also educate the community so that you know the things that you can do to live a life of total wellness and experience everlasting intimacy. So I will see y'all tomorrow. I'm sorry I missed out yesterday, so I'm probably going to try to slip on here and do one more because I want to talk a little bit more about the urinary symptoms that go along with maturity, aging, and postpartum after carrying a baby. So y'all stay tuned. I look forward to talking to you soon. It's Dr. Mia. Don't forget to join the 3-day experience next week, January 16th through 19th. It's going to be fabulous, a weight management focus and total wellness focus. And I'm going to have some experts to give us even more information than we already know. And I look forward to seeing you. Just click one of the links in my Facebook Live and go ahead and join the free 3-day experience. It's Dr. Mia. Bye.